Hi, it's me, Dr. Rana Irfan. I'm a hair restoration surgeon doing hair transplant for last 25 years in Islamabad, Pakistan.
This is very good question. Why do the hair transplant fail? The failure of hair transplant depends on first thing, few things. Number one is that doctor doing hair transplant surgery to you is qualified or particularly trained in hair transplant surgery. You keep in mind, this is very important. The word is advancing towards the subspecialties related to the job doctor is doing to you. Because if doctor is doing wrist joint surgery, he should be trained in wrist joint surgery especially. Now the word is focusing on that. This is word of artificial intelligence, and you need to be trained in a focused atmosphere and a focused knowledge. So once you are trained, you are doing hair transplant surgery, you must be trained in hair transplant, in hair restoration, and your knowledge pertaining to hair transplant surgery should be efficiently enough for that particular person who is dealing with hair transplant surgery. Then comes the evaluation of the patient. You need to keep in mind the patient is optimum case of hair transplant surgery, or it can be treated with medical treatment. If it is possible to treat that baldness or hair fall with the medical, then medicine should be the first option. Then you should be going for surgery. You need to tell the patient that this is ongoing process. Hair loss in male gender, it starts in early 20s and keeps going up to 80s. So this is not a single sessional surgery. You must be very clear on that so that you can elaborate and explain this thing to the patients coming to your office. So what I say is, at age of 50 or around 50, at least back of the head hair in the occipital area and the back of the head, they are considered to be permanent for rest of life. So procedure selection at different ages, this matters a lot in the success of the hair transplant surgery. Because if the patient is coming to you at the age of 26 or 27 and he is bald, your procedure selection will be very different, because you need to put those hair who are considered to be permanent at the age of 80 even. And you need to know what area is most permanent at that particular age, so that you should be putting hair in the recipient area or balding area which will remain there for longer time, up till 80s. This is the doctor who is knowledgeable, who knows these hair are permanent, and if I'm gonna put them in the recipient area, they will remain there for late ages. Okay. And if the patient is coming to you at 50, are you selecting a procedure for him? Then comes the other things, social history. That is very important. So social history is he smoker, alcoholic or not, or is he taking some medicines or illicit drugs, which I mean, is he taking some drugs related to like addiction or something. So smoking plays a big role in failure of the hair transplant surgery. So if you come in interaction or with the patients who they are heavy smokers, you should not be doing hair transplant to them, because nicotine interferes with the microcirculation. So failure is there. If you are doing hair transplant to heavy smoker, you need to keep in mind that you will never get a proper success out of that. So not doing to heavy smokers is the best option. and otherwise ask them to leave smoking, quit smoking at least 4 weeks before surgery. So this is very important topic. And so many things, antidepressants, anticonvulsants, thyroid medicines used, especially used for hypothyroidism, they cause hair falls afterwards as well. And other thing is medical treatment. Yes, surgery cannot be successful if you are not giving medical treatment to that particular patient, because we are transplanting the hair, but who will take care of existing hair? Medicines. You need to keep in mind that every patient will keep losing hair after 80. The amount of hair varies according to the age of the patient, because if patient is in early 20s or late 20s, early 30s, late 30s, he will be having much more hair fall as compared to the patient in 50s or late 40s. So you should be playing with the medicines according to the age and scenario and family history of the patient. Thank you very much.